morning, everybody. Wow, this light here. Are you doing okay? Yes. Did you sleep well? Okay. So let's continue to have fun. Don't you think the skin is the best organ system ever? Did you see the beautiful pictures? All those different diseases looking very similarly. Makes it challenging for us, right? And fun, okay? But again, Dr. Marcella told you the importance of going systematic, step to step to get to the diagnosis. Okay, now ears. How many of you never saw a dog or a cat with otitis? Good, that's what I expected. Okay. So the approach to otitis. So we will briefly, very briefly, review the anatomy of the ear, then how otitis is classified nowadays, diagnosis and treatment. So the ear system or apparatus, it's a labyrinth, right? So it's long, it's deep, so it makes it so difficult for us to assess it. So, but let's review the anatomy a little bit here. Oops, wrong button. So, poof. Okay, so the outer ear is composed again of the concave aspect of the pinna and the external ear canal, which is very long, has an L shape, so a vertical canal, then there is an angle, and then the horizontal canal. And that's why when you're doing your otoscopic exam, you put the otoscope cone there and you do like that, so to straighten that canal so you can see, hopefully, better the canal in the tympanic membrane. So that's basically that very long external canal. Then middle ear. The middle ear is composed of this tympanic. It's basically, again, it's a bony cavity composed of air. So the largest area is this tympanic bulla, which is ventrally located. And then there's a couple of cavities also dorsomedially, the epitympanic recess, where the otic ossicles are located, and the tympanic cavity proper. It's where the oval and round windows will be present, okay? But that's the middle ear. And the inner ear, it's located in this bone, Peters bone, okay? So it communicates or separates from the middle ear by this oval and round windows. I didn't mention the tympanic membrane here, which is considered part of the middle ear, but again, it separates the external canal from the middle ear. Okay, just to refresh your memory there. So for many years now, we classify otitis in primary, secondary causes, and predisposing and perpetuating factors. Some people say causes there too. So I think it's good for you when you see a case of otitis to have this schematic classification in mind, because it will help you with the diagnosis and treatment of these cases, okay? So keep that in mind. So we're going to review that briefly. So causes first. So the causes are what induces the inflammation. It's what comes first, okay? And they can be subtle. Mainly in our allergic dogs, it's basically erythema. And you may not notice that the canal, again, is that labyrinth, and the pinna may or may not be affected. And then it's, in these cases, allergies are a good example from this statement here. You only notice that there's a problem when the secondary cause comes in, okay? So examples of these primary causes, again, allergies. We know that most of our patients with allergies will develop otitis at one, or atopic dermatitis, environmentally induced or food induced, will develop otitis at one point during their allergic life. So very common cause. Parasitic diseases, then we have the otodactic cyanotics causing otitis. Demodex can be in the ear, it causes otitis also. Autoimmune or immune-mediated diseases, pemphigus foliaceus, the concave aspect of the pinna, also convex, but more typically concave aspect of the pinna is often affected in pemphigus foliaceus, and that can extend to some extent to the upper portion of that vertical canal. Juvenile cellulitis, Dr. Marcelo talked about that a little bit yesterday. So muzzle, chin, ears, often affected, as you know, pinna and canal. So, and sebaceous adenitis, which Dr. Marcelo also referred yesterday, it's a very exfoliative type of disease, but the pinna is often affected and the canal in some cases. In all these diseases I talked about here, so allergies, parasitic diseases affecting the canal, and these autoimmune or immune-mediated diseases, clinically, they are different. So that's how important it is, those clinical signs, to help us, again, with a list of differential diagnoses when we're, again, trying to identify the primary cause. Still, in primary causes, foreign body, typically 1 year, they shake their head a lot. So endocrinopathies, rarely you see endocrinopathies, Cushing's or hypothyroidism developing otitis. When I see it, it's usually hypothyroidism that the patient can have a ceruminous type of otitis, but not a very common primary cause that leads to otitis. Obstructive ear disease, so can be neoplasia or inflammatory polyps, a nice picture here from a cat. Okay, secondary causes. This is the type of otitis that you see on a daily basis. It complicates that primary cause, okay? And so it's easy to identify, but it can be a challenge to treat. So again, those are the infectious causes, infectious otitis that we see. So bacteria can be gram-positive, gram-negative. So gram-positive staphylococcus can be Staphylococcus pseudointermedius. In the ear, I see more Staphylococcus schleiferi, okay? So enterococcus, they are also, again, gram-positive bacteria, okay? Corynebacterium can cause it less frequently. And then the gram-negative ones, the nightmare of any clinician, Pseudomonas otitis, because it's a challenge to treat. Proteus also, and even E. coli can cause otitis, okay? And this picture here, this is a case of Pseudomonas otitis, our well-known malassezia, because yeast and fungal, forgot to mention that, of course, yeast will be malassezia. Rarely you have filamentous fungus causing otitis. Aspergillus has been reported, okay? Okay, ay. Okay, now factors. So predisposing factors will increase the risk for the development of and persistence of secondary causes, okay? So let's review them. Maceration of the epithelium in the ear canal. Maceration, when we say that, it's the softening of the outermost layer of the skin, which constitute a very important barrier, skin barrier, okay? That can occur from bathing, not protecting the ear canal, swimming, okay? and even excessive ear cleaning. So that maceration removes the stratum corneum, which is a very important barrier. And that, again, predisposes for bacteria that lives normally in the ear canal and is to cause an infection, okay? Conformation and anatomy of the otic system of paralysis, excessive hair in the ear canal that can change the microenvironment, that can trap moisture, and really, again, predispose to otitis. Congenital stenosis of the ear canals, you see here, Sharpes due to that excessive deposition of mucopolysaccharides in their skin. So the skin is all puffy, right? And the canals are narrow, okay? Brachiocephalic breeds have also a narrower canal than other breeds, especially the horizontal canal, so normally there. Pendulous pinna, which again trap moisture and changes that microenvironment and can change the barrier and predispose to an infection. Okay, so I don't know what, oops. Irritant reactions caused by topical medications. So medications containing propylene glycol, it can be quite an irritant to the skin. Alcohol, okay, or low pH, and that's an example here. You can see erosions and significant erythema there. Trauma or irritation from inappropriate use of cotton swabs or cotton balls, okay? So that, again, mechanically, you can alter the skin barrier of the canals and predispose to infection. Perpetuating factors, those are the factors that we all have to prevent, because if you allow an otitis to become chronic, there are significant changes that are difficult to revert. And those changes will make it much more difficult for you to treat that otitis, leading to a persistent otitis. And again, more prone to recurrences of otitis, okay? Okay, so these changes are capable of perpetuating the otitis, even if that primary factor has been removed or controlled. So we are basically here talking about hyperplastic and stenotic ear canals that occur if you don't manage that otitis properly. So eventually you see that those changes in the ear canal. So proliferation of the collagen in the dermis, epidermis, the wall of the follicles, the glands, all tissues are hyperplastic, leading to that stenosis of the canal. And again, there is also alteration of this epithelium migration, which is a normal mechanism that cleans the ear canal. So cells move in, out. What? And carry epithelial cells, secretion of the glands, the ceruminous and sebaceous glands. So bacteria goes out. This is a normal mechanism of defense. People ask me, I just got a puppy, so should I clean that puppy ear canals to prevent infection? I said, So the body has this normal mechanism of defense. If you start cleaning, you may disrupt that. So no, let the body do this thing. It has a good mechanism there, okay? But that's what occurs in this chronic otitis. And we have this responsibility, I tell that to my students, I tell that to myself, to prevent any case of otitis to reach this stage. Look at that, okay? So again, as I mentioned to you, when you have a case of otitis, think of this classification, okay? So I think it's quite helpful for you to try to identify the causes and, again, and factors and prevent recurrences and treat more properly. So, diagnostic approach, thorough history, needless to say, extremely important, okay? So that will help you, again, determine what is the primary cause here, what are the diseases that are inducing this otitis, that are allowing this secondary causes, the secondary infection to come and cause this infectious otitis, okay? Complete physical examination that will help also a lot in identifying those primary causes. And then again, diagnostic approach, otoscopic exam, that's a must. The canal is, again, long, it's a labyrinth, it's impossible for you to assess the canal without an otoscope. So I don't need to tell you that, I'm sure you know that. Cytology, it's a must also. Every time a dog or a cat is brought to you with a complaint, signs, shaking the head, or red ears, excessive exudate, cytology, a must, okay? So culture and susceptibility, we'll be talking about that. That's a kind of controversial if you should do that for otitis or not, and I'll tell you what we do. Imaging is the only way that you can assess the middle ear is with imaging, okay? If you are suspecting that the otitis externa extended to the middle ear, imaging, okay? Or there is a middle ear disease you suspect because of some neurologic signs, then imaging, okay? So there, and biopsy. Biopsy, if you see a mass, okay, in the canal, you want to biopsy that. Not in all cases, for example, in a cat with an inflammatory polyp, that's so characteristic that you don't typically biopsy those, but any other mass you want to biopsy to see what kind of, again, tissue is there. It's neoplastic or just inflammatory, okay? Because you can see in cases of very chronic otitis, you can see some proliferations in masses that are basically inflammatory. So history, age of onset of ear disease, that helps you determine the chronicity and also helps to some extent also you start formulating your list of differentials. It is bilateral, unilateral, you know, most cases you see bilateral. Cases that will be unilateral, again, foreign body and tumors, okay, or inflammatory polyps, typically, but they can be bilateral also. Head tilt, okay, head tilt can be a neurologic sign. You're going to see that with otitis interna, but other signs of vestibular disease should be present also. But you can see head tilt also in painful otitis, okay? Scratching at the ears, which it's interesting, a lot of the otitis that we see associated with allergies, not often they scratch the ears, so, but definitely parasitic diseases, Otitis cynotis, they tend to scratch more the ears. Discomfort when open the mouth. So if you see pain, the dog doesn't want you to open, signs of pain, to open the mouth, think of otitis media, okay? Seasonal versus year-round, so that helps again to identify that primary cause. Atopic dermatitis can be seasonal or year-round. Food, year-round. Some dogs only swim seasonally, okay? So definitely in Minnesota, where it's so cold and then winter comes, all these dogs go to the lake and swim. So that helps you too. Other clinical signs, again, itching or lesions anywhere in the body, again, will be helpful in identifying that primary cause. Other animals affected, so we know Otitis cynotic is contagious. Neurologic signs, ataxia, circling head tilt, that helps you determine that there is otitis interna, okay? So in response to previous and current treatment. Very helpful to you also. Okay, initial otic evaluation. Observe for any asymmetry of the head and pinna. When you have otitis media, the facial nerve can be damaged. If you have damage of the facial nerve, you have facial nerve paralysis. And then what you're going to see is drooping of the pinna and lips on the affected side. And they don't blink, okay? So that gives that asymmetry of the head. Palpate the base of the ear. It's a simple test to do, and it can be quite helpful. Just here, palpate, you can feel, is it painful? It's harder, the tissue, than normal, which will indicate chronicity, thickening of the tissues in the ear canal, okay? Exudate, when there's a lot of exudate, you hear. So simple, do that bilaterally, okay? Examine the pinna and ear canals. So what's in the pinna can tell us, to some extent, what's in the canal. For example, malacesia, which is a very common cause of otitis, probably the most common cause you see in your clinic. So it's in the canal, and then it can extend to the pinna. So if I look at a pinna and its erythematous is lichenified, I say, okay, I bet it's malacesia. Of course, I'm going to check and do cytology. You cannot, it's fun to guess, but you have to do your cytology, okay? What else there? In the pinna, often again, lesions in the pinna in case of juvenile cellulitis, pemphigus foliaceus, sebaceous adenitis, again, that can extend to the canal. And this will be what's causing, initiate that otitis, okay? So it's damaging there, opening the door for the infectious organisms to come. Examine the ear exudate characteristics, okay? So you can guess based on the color, okay? It's in the, how can I say, texture of the exudate, what's causing the infection. But you have to check with cytology. And again, open the mouth, see if it's painful. The dog is reluctant to allow you open the mouth. If that happens, be suspicious of otitis media. So clinical signs of otitis stenosis are quite variable and will depend on that primary cause, right? And again, I mentioned to you otitis caused by allergies, initially just erythema. Juvenile cellulitis are nodules that drain, significant inflammation, edema. So it varies. Sebaceous adenitis are more exfoliative types of lesions, okay? Presence of the secondary problems in their nature. Again, that's the characteristic of the exudate. It's dark, it's yellow, it's dry, it's moist. In duration, in extent of the problem, because again, if you allow it to become chronic, you have all these changes associated with excessive buildup of tissue there. So stenosis of the canal and proliferative tissue there. We'll show some cases. So the characteristic of the otic exudate and other signs can help you predict the secondary infection. So here, what you think could be causing this infection. So you see my cases are all chronic, but the exudate is this brown, and it's kind of moist. And look at the pinna here. Erythema, this is lichenified. What would be your best guess? Malacesia, yes. It's wonderful to guess. Do your cytology, and I tell you, the skin can trick you. Not always you're right, okay? Okay. What about this here? Same problem in all these dogs. Look at this. Again, quite a bit of a purulent, moist exudate, very erythematous, eroded to ulcerated, painful erythematous, edematous. These poor dogs. What do you think? What? Tell me again. Did you say Pseudomonas?
Yes. It should be a clean discharge.
Are you serious? So Pseudomonas, that would be my best guess here, or Proteus. But Pseudomonas, again, cause these very inflamed otitis. Often the skin erodes to ulcerate. You do a swab, blood comes out. These dogs are in pain, and there is this excessive, slimy, purulent exudate. It's really the nightmare, hard to treat because it's Pseudomonas. Okay, Proteus can do like that also, but typically less severe. Okay, do your cytology. Okay, and again, otoscopic exam. This is a must. You cannot evaluate the ear canal without looking with an otoscopic exam. Okay, so you can have the handheld otoscope. I had that for many, many years, and just a few years ago, maybe 10, 15 years ago, we acquired a fiber optic otoscope, which is much better. You have a much better visualization of the canal. So, and it has a system to flush the canal, so have that deep ear cleaning. So, but it is expensive. They are producing more and more video otoscopes that are more affordable. So I think I encourage you to look up what's available in the market and see if you can acquire one, because it makes a huge difference. I say that if you see a lot of otitis in your practice. So why it's important to do this otoscope exam? So you want to assess the integrity of that epithelium. You want to see is the canal narrow, stenotic than normal. So the exudate, the quality of the exudate, is there a nodule present, any foreign body present in the canal, and obviously integrity of the tympanic membrane. Now, if the tympanic membrane is ruptured, you have otitis externa, it becomes chronic, eventually the tympanic membrane rupture, you have otitis media, okay? So that's one of the reasons for us to prevent any episode of otitis to become a chronic problem, okay? You have all these changes in the canal again that we talked about, and also the tympanic membrane can rupture in those cases, and the otitis will extend to the middle ear. Now, if it's intact, but it's abnormal, like in this picture here, you can see that the tympanic membrane is intact and it's bulgy. So there is otitis media there, or if you have to be very suspicious that there is otitis media present. So this is a cavalier with a disease very common in cavaliers that's called primary secretory otitis media. Okay, that accumulate all the mucus that's produced by the epithelial lining the tympanic bulla. It accumulates in the canal. We don't know the pathomechanism well. It could be an alteration of the eustachian tube, okay, or they produce larger amounts. It cannot effectively drain. So we just don't know at this point the pathogenesis of this. So if the tympanic membrane is intact and normal, you cannot rule out otitis media. There are cases of otitis media with effusion that the tympanic membrane can be completely normal. These animals may not have any otitis externa. You can only diagnose that by imaging, okay? And usually we don't screen those cases. It's internal medicine that's doing imaging for another reason and find it can be one ear or both ears, this accumulation of often fluid. And so that's why you say effusion. Often we see that in cats, okay? So otitis media in dogs, most cases will be an extension of otitis externa, okay? In cats, it's from another mechanism. So it's through the eustachian tube, and it's typically cats that had respiratory disease, and they have this effusive otitis media, okay? And again, often asymptomatic, and it's an incidental finding when they have imaging of the head done, okay? So what if an otoscopic exam is not possible at the time the patient's presented to you? Because it's very painful. There is severe hyperplasia, so stenosis, narrowing of the canal, large amounts of exudate, and the patient is aggressive. So depending on the case, okay, so if there is large amounts of exudate, at that visit, you can talk to the client, okay, we will need to do a very good cleaning, and for me to be able to assess the canal, we have to remove as much as possible that exudate. That will need sedation and a good flushing. If the dog has not eaten, you may be able to do that at that exam. And so something for you to discuss with the client. If behavior is an issue, then you have to make a plan. So give some medications before they come, so you can evaluate better the canal. If it's painful and it's hyperplastic, you may need to give some steroids. Often otitis is painful because of the inflammation. By just treating the inflammation, that relieves the pain, okay? So, but give steroids before, and plan a follow-up exam. Okay, a little bit of otitis media here. And again, often in dogs, otitis media will be an extent of chronic otitis externa, okay? And the facial nerve passes through the tympanic bullae, so it can be damaged. And as I mentioned to you, you have in those cases drooping of the ear, drooping of the lips, and no blinking, okay? So facial nerve paralysis. Cats, more often than dogs, can have Horner syndrome. That's, again, that's a different mechanism. It's damage of the sympathetic branch that innervates the face, and so the eyes primarily. And so you see ptosis, so dripping of the eyelid. In ophthalmos, the globe seems to be retracted, appears retracted, miosis, and protrusion of the third eyelid. And these animals can have conductive hearing loss, okay, with otitis media. Otitis interna, you have more peripheral vestibular syndrome, okay, so they can have horizontal or rotatory nystagmus, strabism, head tilt, circling, neurological hearing loss, or peripheral vestibular ataxia. And again, often, just going back to the otitis media, because it won't be uncommon in cases of chronic otitis, you may not have the facial nerve paralysis, okay? So you don't know necessarily, because the facial nerve paralysis is an indication for you that there is otitis media. But in some cases, you don't know. And so you then examine the external ear canal. See if the tympanic membrane is ruptured, then you know that there is extension to the middle ear. And then you recommend imaging and deep ear flush, discuss with the client pursuing the treatment for that otitis media. So complete physical examination, again, very important to try to determine these primary causes. Now, diagnostic procedures, I mentioned about ear cytology. This is a must in every single case. We'll talk about that. Bacterial culture and susceptibility, we'll discuss. Imaging, CT, MRI, or radiograph, and brain auditory evoked response, or bear test. So ear cytology. Again, you have to do ear cytology. It's very informative to you. So you cannot just look at the clinical signs, look at the characteristics of the exudates and say, this is what it is. As I mentioned to you, you can be wrong, okay? So, and again, purpose to identify secondary causes and assess response to therapy. So you know what's there, then you decide to do your treatment plan, you recheck those cases, and then at a recheck appointment, you have to repeat that cytology, a must to do that, okay? Always collect sample from both ears. Even if it appears that your otitis is only affecting one ear, you have to also collect samples from the other side. Okay? What we expect to see more often, again, we tend to see, at least in our practice, is malassezia. Okay? But cocci can be there too. And this is what you hope you won't see. This is a cytology of a dog, again, with Pseudomonas. Homogeneous population of rod-shaped bacteria and inflammatory cells. Those cases are really challenging to treat. Now, what about bacteria culture and susceptibility? Should it be performed when you have, again, bacterial otitis, okay? So why we even ask that question? Because when you're treating topical, can be the ear, can be the skin, the concentration of the antibiotic on the site that you are treating is much higher than the MIC, or the minimum inhibitory concentration of that product for the bacteria, okay? So the minimum concentration that can inhibit the growth of the bacteria causing the infections. So some people say it can be even 1,000 times higher, but I would say 100, 200 times higher. Then you question why to do culture, because in a susceptibility panel, if the bacterial strain isolated is resistant to some antibiotics, so using topically, you could use that antibiotic. There is a chance that it's going to work, okay? But some universities, my colleagues, don't culture if you're dealing with otitis, bacterial otitis. In Minnesota, we culture, and I'll tell you when we do that, because I need more evidence. It makes total sense to think, because the concentration of the antibiotic is so much higher, that minimum inhibitory concentration needed to inhibit the bacteria, it makes sense to think, okay, even if the bacteria is resistant to a few antibiotics, it still have a very good chance to work. But again, in a case of otitis, there is a lot of other things that can contribute to that. And I want to make sure in certain circumstances that I'm using an antibiotic, that I know that the strain is susceptible. Until there is a good study done that show me, no, for sure, you can do it, okay? So until that, I'm not going to change what I do. So I will perform culture susceptibility in chronic refractory cases or history of resistant infections. If rods are present on cytology, because I'll be highly suspicious of Pseudomonas, okay? And again, if the population is homogeneous and inflammatory cells are present, and if I need to add systemic treatment to the protocol, which will only occur rarely, okay? If the dog has otitis media, I may add systemic, if I can, systemic antibiotic to the treatment regimen, okay? The thing with systemic antibiotics to treat otitis is that, again, there is no evidence to show us that the concentration of the antibiotic will be high in the ear tissue, okay, in middle ear, okay, because that concentration, again, has to be above the MIC. It doesn't need to be 100%, it won't be times for the antibiotic to be effective, okay? So if I can use a systemic antibiotic in a case that I culture the middle ear, I will add that to the topical treatment, okay? If it's impossible for a client to treat topically, I may reluctantly consider using systemic antibiotic. But again, I will be concerned of the efficacy. I never had a case that a client could not treat a otitis patient, so. Okay, imaging, CT, MRI, or radiograph. And again, I mentioned for you to be able to assess the middle ear, that's the only way, it's by doing imaging. If you want to assess the middle ear, okay, CT suffices because it has a good contrast. It's a bony cavity, and so resolution for bone, CT is very good. If you're suspicious of otitis interna, so there are neurologic signs present, so you're suspicious of otitis interna, MRI is best, okay? Radiograph, not very sensitive. Okay, so in Bayer, you are going to perform that. I don't know if you have that in the practice. We have one in Minnesota. If you are suspicious of neurogenic hearing loss, okay, that can occur with otitis interna. Otitis media is conductive hearing loss. Okay, after causes and factors have been identified, then you can develop a list of differential diagnoses for the patient. Now, let's see here. Differential treatment, never mind, because I said, whoops, for the patient. So, and again, start with ear cleaning, right? This is extremely important. Why it is important? Remove the exudate, clean the ear canal. Why it's important to remove that excess exudate from the ear canal? It can impede you from assessing the canal, okay? It can be irritant and add to the inflammatory process. It can impede antibiotics to get to the site of the infection. It can be a nidus for infection. In the exudate, there are enzymes that can damage the tympanic membrane. So it's important for you to remove that excessive exudate, not only to have a good visualization of the canal, but for all the other reasons, okay? Okay, teach owners how to properly clean the ear canals. I cannot emphasize this enough. Don't tell them, don't explain to them, show them. I typically do one ear when they are in the exam room and let them do the other one. It seems very simple, right? Fill up the ear canal, massage the base of the ear, let the dog shave, repeat the procedure at least 2-3 times, I say, until the cotton swab, which they should not put inside the canal, just out here at the entrance, comes clean. And so, they cannot do that properly a lot of the time. That massaging of the ear canal, when you put the solution, often they just move the skin. They don't touch the canal. So you should show there, here's the canal. This is what you have to do. See when I put the solution, how it goes up and down, up and down. So show them, very important, because again, it's important that they clean well the ear canal so you have a good start of the treatment of otitis, okay, the infection. So hospital flushing, recommending chronic cases. We see a lot of chronic cases, and we talk to the owners the first day. will be very beneficial to treat this chronic otitis because it's already a challenge, right? Because the canal often is hyperplastic, it's narrower than normal, there is the loss of that normal mechanism of cleaning of the canal. And so then talk to him about doing this deep ear cleaning, okay? So in chronic cases, we recommend that in most of the cases, ideally under deep sedation or anesthesia, and using the video otoscope with the flushing mechanism that they have. So, but you can do it in a much simpler way, okay? So just with syringes and water, and then try to remove the saline if you're using saline or ear cleaning solution as much as possible. If you're using saline, I recommend trying to remove as much as possible because excessive water in the canal will macerate the stratum corneum and remove that. And again, we mentioned that's a very important skin barrier. So may need to repeat the procedure in these more chronic cases, and this is what you, this is what you can do. Again, saline, trees EDTA, it's safe to use in the canal if the membrane is ruptured. Avoid acidic solutions, and I know a lot of the ear cleanings are acidic because of being potentially ototoxic, okay? But I tell you, I've used acidic solution in dogs with ruptured tympanic membrane, didn't see any problems. But if you can avoid, that's ideal. Okay, oops, don't go. Okay, just showing all the different ear cleaning solutions. I don't know what you have here. A lot of them have acids, again, salicylic acid, malic acid, boric acid. There are some that have 3-EDTA. We'll talk about 3-EDTA in a minute. So 3-EDTA with ketoconazole. So this is epioric, again, it's acidic, but the pH is more neutral in case of epioric advanced. So not sure what you have, but I'm sure you have some product that have those ingredients, one or more of those ingredients. So ceramine and clear otic have squalene, and these you are going to use in these cases of chronic otitis where the exudate became very dry and formed almost like a stone there. We call it urolith. And so that will help. It takes a while. You have to repeat that multiple times. Soften that very hard exudate, break it down, and then it becomes eventually easy to clean. Ideally, in those cases, you should do a deep ear flush. So, but if it's not possible, use esqualene. Just set the expectations to the client. Has to be repeated multiple times until you can reach to that point that you break this hard concretion there with this product. And it's safe to use in cases of ruptured tympanic membrane. So 3-EDTA, so we like to use an ear cleaning that contains 3-EDTA to treat Pseudomonas otitis. What 3-EDTA does, it chelates the cell membrane of gram-negative bacteria. It doesn't do much for gram-positive bacteria. So it opens holes in the cell wall, which will destabilize the cell of the bacteria. It also allows other medications to penetrate, so potentiates the effect of other medication. And it has also an effect in biofilm, okay? So think of a product that has 3-EDTA if you're treating Pseudomonas otitis, okay? Okay, how often should owners clean the ear canals? It depends on the case. In a very chronic, severe case with a lot of exudate, initially, you can even do it daily. It may be until your recheck appointment. Then you reduce the frequency. Or you do every other day until you recheck, depending on the case, twice a week. So there isn't a rule. Every case is one case, and you have to determine that. What's the rule here is for you to show the client how to clean those ear canals well, so it will be effective, okay? So ear medications, we have lots of ear medications, again, to reduce inflammation, oral glucocorticoids, one steroid topical that's very effective, more effective, and I like to use it to reduce hyperplasia in cases of chronic otitis. So the canal, the wall is thickened, the canal is narrow. This has a chance to open up the canal, depending on the stage of that chronic otitis. If it's not at end stage, if you think, no, I can't treat this medically, this is quite helpful. Often you have to also add an oral glucocorticoid in those cases. So for pain, definitely glucocorticoids will help because, again, pain in otitis is typically associated with the inflammation. Some people use tramadol, but I don't think it does much for pain in otitis. So, and again, as I mentioned, Synodic, it contains DMSO, dimethyl sulfoxide, and a fluorinated steroid. The DMSO helps that fluorinated steroid or whatever, or any other medication to penetrate the thick tissue, okay? Because if you use dexamethasone or any other ear product that contain a steroid, if the DMSO it's not there and the tissue is very thick, it won't be very effective. Most likely the steroid won't penetrate deep in the ear canal tissue, okay? But this is what this hyperplasia, this chronic otitis, this is what we need to prevent. So topical antimicrobial agents should be the mainstay, then oral. So otitis you are treating topically, rarely oral antibiotics. If you are suspicious or confirm otitis media, you can consider doing it, but based on culture and susceptibility, okay? And again, we mentioned topical antibiotics can reach concentrations 200, 100, but much above the MIC. May be effective when culture and susceptibility indicates resistance. But you know, in certain cases, I will culture, I won't treat, believe in this, trust this concept, okay, until there's more evidence to show me that that's effective. So I could use antibiotics where the bacteria is resistant and it will resolve the otitis. So until then, I culture. Apply large volumes. You know, the canal is very long, so you want a good amount to be present there, okay? Frequency, I usually recommend twice a day, even if the insert package says once a day. I recommend twice a day. Again, these dogs shake the ear canal. You want a good amount present in the ear canal. We have the products that can be used once. I don't know if you have. Do you have Claro or Osunia here? You do? No, and then I would say I recommend twice daily when you're treating, because eventually those products will come to you, which is wonderful. You can prescribe those products when clients cannot treat or have hard difficulties in treating the canal. So Claro will last for 1 month and Osunia weekly. So for a week, so we have to apply it weekly. Okay. So there's a long list of products here and that you can use in otitis. We won't go now talk about each one of them. Okay. And again, then there's some with fluoroquinolones. I try to avoid using fluoroquinolones when treating bacterial infection or otitis because they are a recipe for the development of resistance. But if I'm going to use it, it again is based on culture and susceptibility. If you don't have many options to use topicals, antibiotic in otitis, you can try using ophthalmic ointments or solutions, but they are very expensive and come in small amounts. If I'm culturing, and again, the product is available to me to use in the ear canals, I cannot use because the bacteria are resistant to them, then I will resource to either compounding the antibiotic or ophthalmic products. But again, they come in small amounts and they are expensive. So this here, you can do, I even questioned, so should I put this slide here? So when you are treating Pseudomonas, again, you can face a challenge. It can really be very difficult for you to treat. And always I culture, and I recommend you culture to select the antibiotic that's going to be used topically. And not always, because they develop resistance to so many antibiotics, so not always you can find a product that contains that antibiotic where Pseudomonas is susceptible, that Pseudomonas strain is susceptible to. Then you can use injectable antibiotics, but to apply straight in the ear canals, okay? So those cases, it's only if I have a Pseudomonas otitis that I will resource to that. And those are typically the antibiotics that Pseudomonas tends to be susceptible to. And they are on the tier, they are second or third tier antibiotics, so we should be avoiding them. But you are using here just topically, so that you're not causing that collateral damage when you use this systemically. Okay? So what can and cannot be used when the tympanic membrane is ruptured? Okay, so there is a list there for you, so I don't think we have time to go over this, but just, again, try to avoid acidic products, okay? Chlorhexidine has been shown to be ototoxic. Of course, the aminoglycosides, polymyxin B, and most ceruminolytics, but squalene, the one I show you that breaks down those uroliths very effective, it's safe to use in the ear canal if the tympanic membrane is ruptured. How about systemic antibiotics? We already talked about it. So how long should you treat the otitis? I would say I recheck those patients for sure. At the recheck appointment, I'm going to assess the patient, see if clinically it has improved, and I do cytology. If clinically it has improved, no organisms on cytology, I may treat for 1 week past resolution. In cases of Pseudomonas, I culture. I want to see a negative cytology, a negative culture, and I go at least 2 weeks beyond that point. Pseudomonas is very frustrating, not only to resolve the infection, but the problem it extends to the middle ear. So when everything is good, you do a cytology, negative, you do your culture, negative, you go for 2 more weeks, later on it comes back because it's very difficult to treat well the middle ear. So it's very frustrating. Again, never rely on client's impression. You are rechecking. You are the one determining if the treatment that you prescribe was effective in resolving that infection. May not rely only on cytology in cases of Pseudomonas. And again, I like to culture. The culture will be more sensitive. I am going recheck. So remember, Cocker Spaniels and Bulldogs are prone to develop end-stage otitis. So severe hyperplasia, look at this. And these we have to, needless to say, to avoid. Oops, come on. Okay, in these cases, total ear canal ablation and bulla osteotomy. So if you palpate the canals, they are hard like a rock, the soft tissue is calcified, there isn't a way you'll be able to open up this canal medically. So refer to a surgeon, ideally a very experienced surgeon, because it's not an easy surgery to do. And if you don't have experience doing this type of surgery, you can have complications often, okay? But what we need to do here is to prevent that from occurring. So avoid that. So again, prevent otitis from becoming chronic by identifying the primary, secondary causes and controlling the predisposing and perpetuating factors. And recheck, and recheck your cases. Maintenance therapy, again, especially important for allergic cases. We cannot, all the diseases that are, the primary disease that you cannot cure need maintenance therapy, okay? Cleaning the ears 1 to 2 times per week. In our allergic patients, you may also recommend some topical steroids to just control the inflammation long term. And again, client education. Am I supposed to stop?
Yes, yes.
Yes,
yes.
Okay. So, yeah, and again, client education is extremely important. They have to understand what you are treating. You have to show them how to do what you want them to do, demonstrate how to clean the ear canals, demonstrate how to apply the medication in the ear canal. So if they understand the problem, understand your recommendations and agreed with your recommendations, because otherwise they won't do it. And so then you have a better chance of success, okay? Okay, so thank you, sorry for going beyond. I don't know if we have time for questions. No? Yes.
Guys, we're breaking for tea and we are coming back in 10 minutes. So just finish and come back.